Welcome, and thank you for joining us today for the meeting of the New York City Health and Hospital Capital Committee. Today's meeting is officially called to order. I would like to propose a motion to adopt the minutes of the Capital Committee meeting held on May 10th, 2021. I will poll each member individually. Jose?
Yes.
Frida?
Yes.
Sally?
Yes.
The motion is carried. Next, we will have the Senior Vice President report, Ms. Flaherty.
Good morning. Good morning, Chair Pagan, Capital Chair Piñamora, and our Capital Committee. Our OFD department has had a robust set of activities underway to support our systems facilities. On the facilities management front, our directors of engineering continue supporting the restoration of many of our surge units across our hospital system. Across our system, there are hundreds of ongoing capital projects we're working hard to support to keep our projects moving through design, procurement, construction, and closeout. Our new bond portfolio, which is less than 5% of the portfolio, is in full swing, and our new design consultants are fully engaged. As of May 28th, we have 1 project in construction, 17 projects completed design and in construction procurement, 19 projects are in design, and only 1 project left to go through the design selection process. Additionally, we received new capital funding from OMB during the April exec plan, and we're looking forward to the issuance of the final capital budget, as our facility CEOs have done a tremendous job advocating for city council and borough president funding, which will supplement our much needed capital investments. In the coming months, we anticipate issuing an RFP for a project management information system to support our facility and OFD teams. While this will take time to put in place, in addition to PeopleSoft, this system will become our capital system of record and will create transparency and provide opportunities for us to identify efficiencies in our capital delivery process, while also weaning us off of independent spreadsheets style reporting. I look forward to arranging an educational session soon. On the real estate front, we have a number of resolutions to present today, and this month we will share with this committee our dynamic current state of the existing real estate agreements we have system-wide. At this time, I'm happy to take any questions prior to presenting our 4 real estate resolutions today. Thank you.
Thank you, Ms. Flaherty. I will ask each member to see if they have any question. Jose?
No questions. Thank you.
Frida?
Sorry, had to find the mute button. No questions, Christine. Thank you for the report, and looking forward to seeing the cataloging of the real estate agreements.
Thank you, Frida. Sally?
I think it's tremendous that you're going to be able to catalog the projects. Do you have any idea, Christine? I mean, I'm sure there's a long lead time, but about how long the process is going to take?
Oh, for the project management system?
Yes.
So I would say this is a multi-year endeavor. We're going to be issuing an RFP this summer, and Oscar has formed a capital development working group, and they will be a pivotal participant as we look to both select the appropriate vendor for the software, as well as look at configuration work. We've been also working very closely with EITS, because obviously this is a software system we're looking to put in place. And I would say we're hopeful that next fiscal year we'll be putting this software, selecting a vendor, and also looking at the implementation process, because this will go across all of our locations, both Gotham, our acutes, and our skilled nursing facilities. While it's a smaller group of individuals that will be part of it, it'll be very important that we integrate this well, and that it has kind of the meaningful tools that each department needs, and allow the roll-up of information from a reporting perspective, as well as work closely with PeopleSoft. So it's not going to be a simple endeavor, but it's a much needed endeavor.
It's a huge undertaking, but it's really going to be transformative. Congratulations.
Thank you, Sally.
Thank you, Sally. I don't have any questions, so let's go to the first item in the resolutions. Ms. Flaherty?
Okay, so this first resolution is authorizing the New York City Health and Hospitals Corporation, the system, to sign a 3-year lease extension with SDM of Stanley LLC, the landlord, for the use of approximately 8,000 square feet of space at 840 Albany Avenue, Borough of Brooklyn, to operate a commodity supplemental food program, the CSFP, managed by New York City Health and Hospitals Kings County Hospital Center, the facility, at a base rate of $136,000 per year, or $17 per square foot, to be escalated by 2.5% per year, for a total of $418,285 for the 3-year extension, provided the system will hold an option to extend an additional 5 years with the rent for the 3-year extension and 5-year option totaling $1,188,111.76. And now I'm going to have Vincent Mulvihill, our Deputy Executive Director at Kings County, present the beginning of this resolution presentation with the background.
Hi, good morning, Capital Committee Chair, members of the committee. The New York City Health and Hospitals Kings County has operated the Commodity Supplemental Food Program at this 8,000 square foot location since 1995. The CSFP is a federally grant-funded program designed to improve the health of low-income families by supplementing their diets with nutritious United States Department of Agriculture commodity foods. So once a month, a food package is provided to our seniors, 60 years of age, and who meet the they reside in New York City and are income eligible. The food package includes 1% low-fat milk, non-fat dry milk, canned fruits, vegetables, canned meats, fish, chicken, cheese, cold and hot cereals, fruit juices, spaghetti, macaroni, whole wheat rice, rotini, peanut butter, and dried beans. The CSFP staff prepackage and distribute the food for local participants, as well as participants across all 5 boroughs. So we get the packages in bulk, and the staff break it down into individual packages, and we ship it out, not just distribute at that site, but we go to 30 outreach sites. We happen to be the 2nd largest distributor within the state of New York for this program. The program provides guidance on the preparation of nutritious meals and other health information prepared by the nutritionists, which includes recipes. CSFP is open Tuesday through Friday, and every other Monday and Saturday. The program's monthly caseload is approximately 10,000 participants. So on the next slide, you'll see that we are within approximately 3 miles of Kings County Hospital. So it's in close proximity.
I do want to add that Vincent and Sheldon and the team are working with the landlord and looking at the entryway and making this site additionally enhanced for our patients that come to this center. Sorry, Vincent, I just wanted to add that fact.
And not only the entranceway, we are working on replacing some of those ceiling tiles and lights as well. So that's going to be ongoing. So the lease terms, next slide, please. Okay. The base rent is $17 per square foot. The 3-year term will commence October 1st of 2021, and it will end September 30th of 2024. New York City Health and Hospitals will hold a 5-year renewal option. The option term will commence October the 1st of 2024. Total per square foot occupancy cost is within the fair market value range of $17 to $26 per square foot. A United States Department of Agriculture grant provides funding for CSFP. The program is administered at the state level by the New York State Child and Adult Care Food Program. The grant covers operations, including personnel and the real estate expenses. Current funding expires in September of 2024, with future funding anticipated. The program is optimistic about receiving a new 5-year grant. If the grant is received, health and hospitals will exercise the 5-year renewal option.
The next slide shows you the rent schedule for both the first 3 years that this is seeking resolution approval on, which ties into the time frame of the grant being currently covered. And then we were able to, recognizing there would be a cancellation should there not be funding for the 3-year, we also negotiated 5 additional years at a very cost reasonable rate now, so that if the grant is in place and authorized, we would be able to go into that 5-year total, showing the $418,000 for the first 3 years and $769,000 for the next 5 years with the 2%. This was it took a little time to negotiate, but I do want to thank the real estate team to make sure we kind of lined it up our agreements with the timing of grants. And the next slide is the actual resolution itself, which I've read already. Happy to take any
Thank you.
questions at this time.
Thank you, Ms. Flaherty. I would like to ask each one of the members if they have any question. Jose,
No questions, thank you.
Dr. Katz,
No questions, thank you.
thank you. Frida,
Just a couple quick questions. Christine, I'm not sure if this was mentioned, but what is the increase over the current lease?
You're right. this was-
2.5%.
I'm sorry?
2.5 off the current.
Off the current. Okay, so basically the terms of the extension as well as the option year for the additional 5 years is just almost on the same terms, right? It's 2.5% escalation per year. So that was a great ability to have that match up with the time of the grant. Is that right?
Correct. Leora, I think we have it. Yes.
I will go back for you to double check, but I'm almost positive it's 2.5 off the current. But yes, it's the idea is to have it all aligned with the funding sources like we've done on the WIC sites.
Right, and we're not exposed to additional escalations at the renewal time. It's already set based on the current terms. Is that? And I think that's what you said, Christine, right?
That's accurate.
Yeah, that's great. I did note that in the fair market value report, he references that there was no information on escalations, but I don't know. It seems to me that 2.5% seems a reasonable market level escalation, but I don't know if we can just, I'm not sure why his report stated that.
We can go back to Savit and ask them to correct and modify because 2.5 is our standard, frankly.
Right.
You might have seen a lot of real estate transactions where we're looking at 2.5%.
Yep.
But we'll go and question Savit, and if needed, there'll be a slight adjustment in the full board resolution related to that, Frida. That's a good catch.
Great. Thank you. And just a question, and I think we've talked about this before, and it would be good as part of the the inventory that you're doing of the leases to get a better understanding on this. It's how did the taxes work for our leases that, do we, since we're not subject to taxation and can, here it seems we're paying taxes on this lease. Is that true for all of our leases? And having a better understanding of, I don't need an answer for this right now, but I think when we do kind of go over the real estate portfolio, it would be great to have some clarity around that.
Okay, we'll look at that aspect of this. I think some of these leases, as you know, are tied to other providers that aren't actually health and hospitals employees. And so it does make it a bit complicated. In this case, the tenants are tied to this grant. So, but we will, I understand what you're kind of pointing out, and we'll look to see what we have.
Okay, thank you.
thank you, Frida. Sally?
Yes, are the 30 distribution sites hospital sites or hospital-run sites, or the other sites as well?
No, it's a combination. Some of them are senior centers. Some of them are, well, most are senior centers. There are no real other hospitals that we distribute to.
That's curious. The city must have its own disbursement of foods to senior centers. I guess this is just a supplemental program?
Yes, it is, following the guidelines that the state has set for us. So the seniors have to be above 60. They've got to be income eligible, and they've got to reside within New York City. And the food that we get is from the state. And we have clear guidelines as to who we sign up for it. But we do distribute throughout the 5 boroughs in New York City, not just
Okay,
at that site.
Thank you.
Thank you, Sally. I just have a comment, Vincent and Christine. Thank you for your comments on terms of ensuring that this new lease will include also kind of looking at some of the areas. And I really like how you are looking at the inside in terms of the light, the ceiling, as well as the outside. So thank you so much for your attention to those very important aspects to ensure that our, our community feels kind of welcome and respected. So thank you so much. And again, thank you for all the negotiations that you have done for this lease to continue to provide this very important service to the community. So if there are any other questions? If none, let me take a vote. Jose?
Yes.
Dr. Katz?
Yes.
Frida?
Yes.
Sally?
Yes,
Veniowski voted yes, so this is passed. Thank you so much. Christine,
Thank you.
the next one.
So the next one, what I'm going to do is read the 2 resolutions associated with this robust PowerPoint that covers both resolutions, since the topics are incredibly similar at 2 of our major acute care facilities. The first resolution is authorizing New York City Health and Hospitals Corporation, the system, to sign a 5-year revocable license agreement with Tasty Picks 2, Tasty Picks, for a license for the use and occupancy of approximately 1,956 square feet on the first floor of North Central Bronx Jacoby, a division of New York City Health and Hospitals Jacoby, NCB, for the operation of a restaurant at a monthly charge of $5,500 per month, with annual increases of 3% for a total revenue to the system of $350,402.95 over the 5-year term. The second resolution, authorizing New York City Health and Hospitals Corporation, the system, to sign a 5-year revocable license agreement with Andes of Kings County Corp., Andes, for a license for the use and occupancy of approximately 3,336 square feet on the first floor of New York City Health and Hospitals, Coney Island Hospitals, CIH, for the operation of a restaurant at a monthly charge of $8,000 per month for the first year of operation, with an annual increases of 3%, provided there shall be 6-month 50% rent abatement at the start of the agreement, for a total revenue to the system of $485,667 over the 5-year term. So now for this presentation, I'm joined by both Chris Mastromano as well as Svetlana, our leaders of these facilities, and I believe Paul Albertson may or may not be on the line. He's not on the line. Okay, so I will cover the element of the presentation from our supply chain colleagues who helped us pull this together. Let's go to the first slide. So food services within our hospital system is an important body of work. On-site food options is really important for both our staff and our patients. In many cases, our facilities are not near retail corridors to access food conveniently. And sometimes the break schedule is very tight within our large facilities, and having on-site food services is very critical for both patients, staff, and visitors. Healthy food options are very important to health and hospitals, and ensuring the food that we are providing on-site through vendors is appropriate and healthy, and follows our healthy beverage initiative as well as other dietary concerns. We also want to ensure the food sources are cost conscious and priced reasonable for our staff, allowing them to get access to healthy food conveniently and affordably. The system's made a policy decision to install operators for this affordable, healthy food on site, and to do this by having license agreements so that we can have locally based vendors that meet all the criteria. While Paul couldn't join today, they had looked at the potential of looking at a system-wide food provider. But given the uniqueness of our system, our locations, and all of the criteria we were putting in around cost consciousness, as well as healthy characteristics of the things being offered, it was realized through that process that the most efficient thing to do was to secure locally based vendors that were able to provide all of those criteria that the system was looking for. And so these are the first two resolutions around that background. Let's go to the next slide.
And Christine, hi, it is Paul. I apologize. And let me just
Thank you.
underscore what Christine has said as it relates to both our interest in working locally to make the best food options for our individual facilities. We have worked closely with our CEOs to be able to talk this through against a couple of changing elements in our system. One is, as Christine mentioned, the New York City Healthy Food Standards really does require a certain offering of caloric foods and choices, which, you know, as it says, is healthy food initiative. And that's an important component. The second piece is we've also embraced the no provision of sugary beverages in our system. You know, so this really helps us to further the healthiness of our offerings, and also, you know, does limit the income that's available to large vendors who are interested in our system. So together, we thought the combination of being able to provide appropriately priced food, ones that can be ethnically, culturally appropriate, as well as healthy, and supporting our community is something that Mercedes Redwood, who's our chief registered dietitian with the system, and our CEOs collectively, is the approach that we thought would best serve our community. Thanks, Christine.
Thanks so much, Paul. Really appreciate it. And so now we're going to first cover the resolution for Tasty Picks 2 Corporation at North Central Bronx of Jacoby with Chris Mastromano.
Good afternoon, everybody. So good morning. So we're very pleased to present and ask for consideration to bring Tasty Picks 2 in. They're a Bronx, they're a local business. They have over 10 years experience. They have several small companies a few blocks away. They offer a very healthy food option choice, sandwiches, salads, smoothies, and they will be glad to comply with our New York City Health Beverage Initiative. There is no currently anybody on site in North Central Bronx. There hasn't been for the last 15 months. Next slide. So they're going to occupy space that was the square footage identified earlier that was formerly occupied by a prior vendor. They're going to start off with at least 16 hours a day and rapidly expand based on volume. We have annually about 300,000 patients and visitors come through North Central Bronx with all the ambulatory sites, including the emergency room. So we think, I know the staff and the community is going to really appreciate it. Next slide. So the resolution identified that there would be an occupancy fee of $5,500 per month with a 3% escalation per year. With the total, as Christine read, of $350,402.95 over the 5-year term. They'll occupy 1,956 square feet, and their occupancy fee is $33.74 per square foot. We'll do an initial term of 5 years. Except for CPI changes, we will approve any menu prices increases. We're very aware and conscientious of our staff. We want to make sure that it's affordable food. We don't want to outprice and they can't afford to obtain a healthy meal.
The other item I would just mention is the vendor themselves will be responsible should they need to make improvements in the space. So that's kind of a key element of their responsibility as well. This space is ready, so it's not substantial improvements needed, but did want to point that out. So this is the resolution itself. Any questions for our colleagues at NCB, Jacoby, before we go to Coney Island?
Thank you, Ms. Flaherty. Let's ask the members. And should we take, Colisha, the vote for this resolution? I think both of them should be looked separately. Is that correct?
Yes, after questions, we can vote on this resolution.
Before moving to the next one. Okay.
Yes.
Jose, any questions?
No, just glad that we're seeing this and it should benefit employees and give them choices. So thank you.
Thank you, Jose. Dr. Katz?
No questions.
Thank you. Frida?
One quick question, Chris, is what's in the space right now that Tasty Pick is going into? Because there's no food option now at NCB, right? Is that what you said?
That's correct. We have a farmer's fridge and a couple of vending machines on the outside. We were using this space for when the vaccine clinic was very, very busy. We were using it as a vaccine site, but that is changing, and we've consolidated vaccine space, so it's empty, ready to be occupied.
And it's all, I think Christine mentioned, ready for them to go into, so they can start right away, not any construction time or.
Yeah, that's correct.
Yeah, that's great. And agreed with Jose, I think this is a great option. We talked about it a little bit at our visit to Jacoby as well, food options. So glad to see this. Thank you. Thank you, Penny.
Thank you, Frida. Sally?
Yes, I have 3 quick questions. One, I just want to confirm that operating expenses like the HVAC and security, were those all rolled into assessing the appraised value for the space?
So essentially, when they looked at the appraised value, they had to look at similar spaces around the area. And so obviously they're coming into the existing space as is. And so, yes, it would have been considered as a general similar space in the neighborhood that had the same kind of physical conditions. I'm not sure if I've fully answered the question, but.
Yes,
Okay.
you did. Number 2, there was no formal RFP or solicitation process, but I assume that people worked and looked at different options before settling on this one. Is that right?
Yes, Sally, that is correct. Christina Contreras and her team, before she left, they had visited several of the local vendors to go through. They had a small work group with staff and people, and they found that this vendor was most reasonably priced, had the most healthiest food options, and we felt that would do the best for the community.
Having been at NCB and looked for food, I can tell you that the pickings are slim over there. So it's very exciting. Thank you.
Thank you.
Hey, thank you, Sally. Again, Chris, thank you, and Christine. As other members have mentioned, this is wonderful, and I like the way that you emphasize healthy food as well as reasonable price. So that's really a good combination. I know, Chris, in the past you have mentioned that NCB does not have right now currently a farmer's market, because that's another way for people to also get certain types of fresh food. Is there anything that you would like to share in terms of thinking for such farmer's market in MCV, or?
Absolutely. So they're coming for a visit this week. We've made arrangements. We're going to begin it this summer. We're very excited. We identified space. We'll do a modified farmers market. We can't wait. And I thank you for raising that when we spoke, because we got right on it.
Oh, thank you. And I'm so glad to see that you almost have already a visitor. That's really good. And again, this enhance the options, particularly if they have fresh fruit and others that they could also eat, particularly in a hot summer day. It's always good to have some fresh fruit. So thank you so much. Now I would like to take the vote. Jose? Jose?
Yes.
Okay, sorry, I couldn't hear you. Dr. Katz?
Yes.
Frida?
Yes.
Thank you, Frida. Sally?
Yes.
I also voted yes. Again, thank you so much. The resolution is, the motion is carried. Thank you. Christine, the next one.
Thank you. Then Svetlana will cover Coney Island's resolution that I read. Svetlana?
Yes, good morning.
Good morning.
Coney Island has offered food to staff and visitors on our campus since 1998.
I'm sorry, Svetlana, it's difficult to hear you.
Is this better?
Yes.
Yes.
Okay, so we've offered food here on our campus since 1998. We serve approximately 100,000 staff and visitors and patients annually. We are rather far away, and I'll show you a map in a minute, from other healthy food choices. It's about 0.4, 0.5 miles, which is a burden for our staff, especially if they're trying to grab something on a short break. And frankly, food was the very first thing I heard about when I arrived here in January of 2020. It is a major issue for our staff and our residents and our visitors. So we're very excited to be bringing this resolution to you. Andy's, which is the vendor we're trying to bring in, they will occupy 3,336 square feet on the first floor of our main building. So that is our outpatient, will be in the future, our outpatient-focused building, and it is a main thoroughfare for our campus. This vendor operates at Kings County Hospital, as well as operating a small gift shop here on our campus already. So it's a vendor that is very well known to both us and the system as a whole. They will offer a menu of healthy food options, hot and cold food, sandwiches, salads. It's a very extensive menu at a very reasonable price, which was the other piece that is incredibly important to our staff members. We want to make sure that they're not priced out and that they're able to get a healthy meal at a reasonable price. So Andy's has been operating a food concession in Coney Island in the past, and they have been a very good partner to us. They've stepped in multiple times on very, very short notice to cover our food concession in cases when we weren't able to provide it otherwise. And they've actually, even in the last 6 months, they've offered food through their gift shop when our food concession that was here before I was actually closed. So they've been a very good partner to us over the last 12 years. Next slide, please. So this is a map of what's available around us, and it's a little bit of a food desert right in front of us, other than for the fact that we do offer a farmer's market in the summer. It's very well used. But in terms of prepared food, you have to walk a relatively long distance to get a meal. Next slide, please. So Andy's will occupy the 3,000 square feet right by the front door of our main building. And That is a major entrance point for us right off of Ocean Parkway, will continue to be a major entrance point for us. They will also continue to operate the gift shop which is located much closer to the new tower that is going up on our campus. It's actually right adjacent to the lobby of the new tower. And so they will be able to offer food in both locations. So there's convenience for our staff and visitors. Next slide, please. So this resolution is a request a license agreement at an occupancy fee of $8,000 a month with a 6-month 50% occupancy fee abatement at the beginning of the license agreement. It'll escalate by 3% per year for a total of $485,667 over the 5-year term. The rent abatement is necessary because the prior vendor that was in the space left the space far from being a white box. So a lot of updates needed to be made in order to actually make it occupiable. So that's what the rent abatement was for. The licensee, again, will occupy 3,336 square feet over 5 years, commencing August 15th and 2021 and ending August 14th, 2026. And the occupancy fee is $28.77, which is in line with the market value of $29 per square foot. And the agreement will be terminable upon a 30 days notice. Next slide, please. And this is the resolution. Did he answer any questions?
Thank you, Slavana. Let me go through each one of the members if they have any questions. Jose?
No questions, thank you.
Thank you, Jose. Dr. Katz?
No questions.
Thank you. Frida?
One quick question, and I just noticed this in the Tasty Picks agreement that there is a ability for, well, they can't increase prices above CPI without approval from NCB. Is there a similar kind of an arrangement here with Andy?
Yes, all prices will have to be approved by us. Any price
Great.
increases will have to be approved by us. And in fact, the prices that they're putting in place are the same prices they were charging in 2016.
Oh, great. That's terrific.
Yeah, price was a
And-
major driver. We wanted to make sure that our staff was able to get.
It's affordable. Yeah, that's great. And then on the rent abatement period, is that, one, I assume they're responsible for the build out and the cost of that. Is that correct?
That is correct.
Okay. And just in terms of the prior tenant, is that if the condition was, are there any terms in which they were supposed to have left the space in better condition, or any recourse we have with the prior tenant on those kinds of situations?
It's a complicated situation.
Okay.
It's a little bit challenging. We're following whatever options we have available to us. At the moment, the most important thing to us is to make sure that our staff, once again, can actually get a meal on our campus. It's been
Right.
very much a hardship, so.
And we're happy to brief you offline, Frida, should you have additional questions regarding that.
Okay, sure. Thank you. And just in terms of during the first 6 months when they're doing the build out, or the however long it takes them, will they be operational, or they can't open until that's all done?
So they will be operational very, very quickly. And in the meanwhile, they will continue to serve food out of the gift shop. But we expect that they'll be able to wrap things up incredibly fast. Everything is geared up to get going. So we should be able to open.
Okay. Thank you.
Thank you, Frida. Sally?
2 questions. One, I noticed in both summaries that they mentioned that the system is not looking to maximize revenue generated on these 2 sites, which are very modestly sized sites in any event. But I was wondering, was there a comparison done, or like, do you have off the top of your head if this was leased for kind of a maximum use, not necessarily to serve our residents and staff, et cetera, what the market value would be? And that's my first question.
So I think there's kind of twofold ways to think of what you asked, Sally. So the Savitas estimate is around the real estate physical market value, but I think part of your question was around if we tried to rent it out for, to maximize revenue for a private organization, not necessarily providing benefit to the hospital system. Is
Right.
that what you?
Yes.
And so I don't, I don't. So the real estate assessment that's in this resolution is kind of what it is, regardless of the occupant per se. I don't know, Paul, if you have any specific assessment around other uses around the space. I mean, it's kind of a little bit of a difficult question that you're asking, in that the space itself, in all cases, is on the inside of the hospital. And so
Right.
it's not like a street retail
Right.
kind of, while
Right.
both of them are close to the street, they're not the same as looking at kind of retail space on a busy street. And so I don't know if, Paul, you have anything to add to this, but it would be difficult to do the type of assessment you're asking.
For example, we've rented to eyeglass providers, and I don't know if we treated them the same way. I'm just curious about the price.
I think from a real estate perspective, we did treat them the same way. We looked at kind of a market physical cost inside space, and in all cases, they then are also still inside of our hospital space. And I think we focused on the value it brings to the patients and staff, not necessarily adding revenue, because that's not, we're a nonprofit. So I don't know if I fully have answered your question, Sally, but I'm trying to.
Okay. Well, we can continue the discussion. I don't want to hold us up. My second question was just, there are a lot of restrictions that have been imposed on both of these in terms of controlling costs, the kind of food you can serve. I guess that they're comfortable that they're going to generate a volume that's going to help offset the cost limits imposed by some of these restrictions.
So I'm
Yes, I would.
to that.
Go ahead.
Andy is very familiar with our facility and the volume that they could potentially generate. They've done quite a lot of analysis on that. They're also familiar with Kings County. So the restrictions are not new to them. They operate under them at another facility. So
Thank you, Stella.
Yep, they're very eager to get going. They think they can do reasonably well here.
Terrific. Thank you.
Thank you, Sally. I just have a question following up on Sally's, and I don't know if that's what the issue may be. Is in the rental, does include utilities or not? I think that's maybe one of the cases.
Yes, there's not a separate sub-meter. We don't. No, we do not have a separate sub-meter in these tiny spaces inside the building. So utilities are covered within the rental fee.
And when we say the market value number, is that for spaces including utilities, so that we're comparing apples and apples?
I believe so. We can triple check that with everybody, and if needed, we'll add that fact into the resolution.
Okay, yeah, I think it's just, as Sally was talking, and that was one of the issues that kind of I kind of thought about it, the issue of the utilities, and I understood that, it's very difficult for us to have separate meters for utilities of these spaces. So that again, I just want to thank Slavana and her team and your team, Christine, for looking out for our employees and ensuring that they have options, healthy options at a very reasonable price. And I believe that also our patients will benefit from that also. They will be able to have healthy food and a reasonable price. I think it's a win-win situation for them. Just in that venue, I have seen some places that actually serve food that they take snaps. I don't know if in this case, in this cafeteria, I don't think they will take it, but just in case some of our patients use that. Do you know?
I'm not familiar offhand with that question. So we would have to inquire to these two vendors if they accept SNAP on site, on the spot.
Yeah,
So.
I don't know. I have seen some places which to me was a little bit kind of interesting because these were processed food. Usually SNAP is for supermarket or markets, but these were restaurants that were serving food and somehow they took SNAP. So just a question. But again, thank you so much for all the work. And I don't have any more questions. So I will ask every member of the committee for their vote. Jose?
Yes, thanks.
Dr. Katz?
Yes.
Frida? Frida, you may be muted.
Sorry. Yes.
Okay, thank you, Frida. Sally?
Yes.
Okay, I voted yes, so the motion is carried. Thank you so much, Slavana. Thank you, Christine, also for presenting this. I think we have another resolution, and Jose, you...
Yeah, I will recuse myself from this one. Thank you, Fanny. Bye.
Thank you, Jose. Thank you. So
Thank
let's
you.
wait, Christine, let's wait until Jose leaves the room. I think he already...
I'm getting the nod from Calicia that he's left the room.
Okay, that's good.
Thank you.
Thank you.
And so Bill Hicks is away today, but Chris Roberson, I believe, is on the line with me. This is a resolution authorizing New York City Health and Hospitals Corporation, the system, to execute a revocable 5-year license agreement with New York University Medical Center, the NYUMC, for its use and occupancy of 42,880 square feet of office space and 15,691 square feet of laboratory space in the C&D and administrative buildings at NYC Health and Hospitals Bellevue Hospital Center, the facility for administrative offices in connection with its residency and research programs at a rate of $50.80 per square feet for the office space and $58.50 a square foot for the laboratory space, to be escalated by 2.5% annually, with the price per square foot to be reset to market after 2 years. So the background here.
Good morning.
Chris?
You want me to do background?
Sure, Chris, go ahead.
Good morning to the committee and all. New York University Medical Center, a nonprofit medical school and hospital and longstanding medical affiliate of the New York City Health and Hospital Bellevue. In New York Medical College occupies space at Bellevue subject to the affiliation agreement. It also occupies space related to its role as a medical affiliate under the space license agreement, first authorized in 2011 and renewed in 2016. Under the license agreement, NYUMC pays the system a occupancy fee that is at fair market value rate. In 2016, NYUMC occupied 15,691 square feet of laboratory space, which has escalated to the rate of $60.80 per square feet, and 42,880 square feet of administrative space, which has escalated to the rate of $54.14 per square feet. The administrative office space is used in connections with adult psychiatry, medicine, neurology, ophthalmology, orthopedics, pediatric, and surgery programs. The laboratory space is used primarily for research and includes medicine, neurology, pediatric, ENT, cancer programs, and may involve clinical studies like for device testing, drug trials, and medical record reviews and social behavior observation.
So we embarked upon doing a review with NYU, and there's still the need to occupy 15,691 square feet for laboratory space, as well as the administrative space. As indicated in the package, Savit's assessment of the market today, post-COVID, is that the real estate market has dropped a bit. And so we are required to have a fair market rate. And so for this resolution, what we did was working with NYU, we wanted to do, since the rate per square foot is a little less than the existing rate because of the market assessment and the fair market assessment, we want to do a 2-year agreement here instead of a 5-year so that we can reassess the market and we can look at potentially bringing this back up to where it was after the recovery. We are also looking for the 5-year acceptance should we, after the market assessment, enter into a reasonable rate again, hoping that we can get it higher than this current rate now, because we do believe that the market will increase and improve. The facility does provide utilities, garbage collection, building security, and NYUMC provides equipment, interior repairs, housekeeping, non-structural repairs, and other services required. The last slide is the resolution itself, which I've already read, and we're happy to take any questions related to this resolution.
Thank you, Christine. Let me go first, Dr. Katz.
No questions.
Thank you. Frida?
Just so, Christine, I think what, if I'm understanding it properly, you're going to have, we're at a lower market rent right now, given the drop off in the market than what we were before. That will escalate by 2.5% for next year. And then after the second year, we'll do a reset of the fair market value. And then it escalates 2.5% from there for the last 3 years. Is that the structure of the contract? Okay.
Yes, that's correct. We didn't want to lock in 5 years. We wanted to see, and we'd probably do the assessment in advance of the 2-year period, 18 months in or something like that, to see if the market has improved, like we believe it will. But, it's kind of a very chaotic time in real estate to start looking at market values.
Right. And that assessment is a upward or downward. So hopefully not going to happen. But if things continue to deteriorate in the commercial market, then we're subject to both up and down. It's not a one-time look upwards, right?
That is correct. It is up or down. I mean, I think Bellevue is very well located within the science research corridor. There continues to be redevelopment, talks about additional laboratory space and medical space in this area. So I don't think we feel instinctually that it could go down, but we do want to give ourselves that option of looking at that in 2 years.
Right. I mean, I think it's the right thing to do, even with the downside possibility, to have that adjustment given the state we're in right now. So thank you.
Thank you, Frida. Sally?
Well, I think it's a significant amount of space. I think it's important for NYU, especially given their relationship with H&H. And so I was hoping that you guys would be particularly aggressive with NYU. And you were brilliant with your 2-year and then reassessing at that point. Good move.
Yes, we can. Thank you, Sally. We have to do fair market, so trying to figure out how to track that.
Thank you, Sally. Again, I would like to echo what Sally and Frida mentioned. A very smart business move to put that clause to reevaluate. Of course, there is risk, but we are New York strong, and we are betting that New York City is going to get better. So we're looking to going up, no down. So thank you, Christine. So if there is no other questions, I will ask for the vote. Dr. Katz,
Yes.
thank you. Frida,
Yes.
thank you. Sally,
Yes.
thank you. I also voted yes. The motion is carried. Thank you, Christine, and thank you everyone for putting this together. I believe
Thank you so much.
that's the last one.
Yes, yes,
Okay.
that is our last resolution.
Thank you, Christine. Any old business that we need to discuss? Any new business? Well, without being any further discussion, this meeting adjourned right on time. So
Yay, Penny.
so Frida,
Thank you.
we are now going to your meeting. Thank
The
you.
bar is
No
high.
pressure. No pressure.
20
Thank
minutes
you.
and right
Have a
on
great
time.
day.
Bye. Bye.
Take care.
Bye.
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 Thank
Thank you,
you.
Vincent.